Hi guys, how are you? Today we're going to talk about the Mayo block, and I thought what I'll do is just go through the nerve distribution when performing this block, and then my colleague Abdel will demonstrate the block in theatre. Okay, so the Mayo block is a ring block around the first metatarsal. So whenever we're doing a procedure that involves the first metatarsophalangeal joint, we almost always do a Mayo block. So the first block is just distal to the midfoot in that IM space. Okay, so the deep peroneal nerve is in there, and the deep peroneal nerve, once we numb that, it is going to numb pretty much that intermetatarsal space. So the first needle, as Abdel will demonstrate, you will go straight down, perpendicular to the sole of the foot. You'll go all the way down until the needle almost exits the bottom of the foot. When you dump 2 or 3 mil at the bottom of the foot, it will also get a branch of the medial plantar nerve. So through this first injection, from the dorsum of the foot to the plantar aspect of the foot, when we make the wheel at the top, it will get some of the superficial peroneal nerve as well. It will get the deep peroneal nerve, and at the bottom, it will also get part of the medial plantar nerve, which is a branch of the tibial nerve. The deep peroneal nerve is a branch of the common peroneal nerve. And the other nerve that comes down, exits around the leg here, is the superficial peroneal nerve. And what that will do, it will pretty much, that would be its dermatome there. So we're then going to cover this section of the first metatarsal and the hallux. So once the needle comes out, then we're going to direct it this way, and it will end up getting the medial dorsal cutaneous nerve, which is one of the terminal branches of the superficial peroneal nerve. Then we are going to continue the ring around this part of the foot, and this section here is saphenous. So once we get saphenous, then we are going to direct the needle underneath the foot, and it will then anesthetize. And see, my daughter is ticklish, and it will then anesthetize the remaining portion of the medial plantar nerve. So the nerves that are going to get anesthetized: deep peroneal, superficial peroneal, or its terminal branch, the medial dorsal cutaneous nerve, saphenous nerve, medial plantar nerve, which is the branch of the tibial nerve. Thank you.
I'm Abdel, I'm one of the SPS registrars and assisting Ozan today. This gentleman we met earlier before is having an Austin chevron bunionectomy with a soft tissue release on his second extensor tendon there. I'm going to be going through a first metatarsal or Mayo local anesthetic block. So in this local anesthetic, we've just got 8 mils of Marcaine 0.5%, and we've got 2 mils of 8 milligrams of the dexamethasone, so a corticosteroid. So the Mayo block is quite effective for all first metatarsal procedures. The first part of the injection is you'll give a block in the IM space, so proximal towards the first MC joint and proximal from your incision line. You want to aspirate, go as far down as you can, and this is going to be blocking our deep peroneal nerve. So you can see it should be right towards the bottom of the foot. You want to give a few mils here, come out, and from within the same portal, you want to go across the dorsal aspect of the foot there, and you should see that needle wiggling underneath the skin, and this is going to block our medial cutaneous nerve. And you can see a blob on top of the skin there. Where our blob finishes, you want to give another injection along the middle aspect of the foot. Again, seeing that nice big blanching that's occurring.
And what nerve is that?
So your saphenous nerve there, and then coming down plantally, you want to. This is going to block your tibial nerve. The tibial nerve, there's some discrepancies. So you want to make sure it's on the sole of the foot, and one of them is quite just underneath the metatarsal itself. So you want to give a block just under the metatarsal, and give some more anesthetic on the plantar aspect of the foot, and come out. So from 3 portals, we've anesthetized all that distal first metatarsal.